I think well-meaning public health authorities put out guidance that is simply unsupported by evidence. And unfortunately, in many instances, that results in harm. And indeed, if you think about, something like a decade and a half elapsed in the time from when the American Academy of Pediatrics, along with other official government organizations, were actively recommending against many young children from eating peanuts. And that advice was the exact opposite advice of what they should have given. And as a result, untold numbers of kids, unfortunately, developed very serious peanut allergies.
Yeah, the statistics say 3% have it, but it feels like anecdotally, at least, in both my son's schools, it was a lot more than 3%. You mentioned Israel in your book. It's a country where peanuts make up a big part of the daily diet. Peanut allergies there are really scarce.
Yeah, it's such a fascinating story. There's a snack called Bamba. It's kind of like Cheetos, except it's peanut flavored rather than cheese flavored. And infants in Israel for decades and decades, I think it came out in the 1960s, have been gobbling up these little Bamba snacks. And what we observed years and years before the bad guidance from the AAP was that the incidence of peanut allergy in Israel was incredibly low, and they even compared those children ultimately to genetically similar children, Jews in Great Britain, who had a much, much higher incidence of peanut allergy. And it was obvious this was because the kids in Israel were exposed to it. And this is part of a broader hygiene hypothesis theory, where it's if you are exposed to things in a young age, that helps train the body not to recognize that as a threat. So what I talk about in my book is example after example of where there is empirical evidence in the world, real-world evidence showing us something, yet the experts in America ignored real-world evidence and instead favored their own theoretical ideas. And in doing so, really set us on a dangerous course. And that's exactly what happened during the pandemic as well, with so many of the interventions that they required on children.
So getting back to food allergies, are there other examples or other foods we should be exposing our babies and toddlers to that we don't? That could,
The experts say that by and large, you want to expose a baby to as many different foods as possible once they can safely eat them, as far as the consistency of the food.
Nobody's going to give peanuts to their 2-month-old.
Exactly. You're not going to give that, but a peanut product and eggs and shellfish. And then more broadly, kids who grow up on a farm are said to have a lower incidence of various, hay fevers and things like that, because they were exposed to all these allergens, quote unquote, at a very young age. But to me, the bigger story, again, is less about peanuts and more about a pattern that I describe in my book in many, many examples of where we have public health authorities, again, who I believe are well-meaning, but where they put out guidance with a assuredness and with an arrogance almost that you better follow this, and if you don't, you're a jerk, which is how we were told, during the pandemic with so many things, when this guidance oftentimes is simply based on theory. Millions of children in Europe were back in school in the spring of 2020. This was real-world evidence, millions of kids. That real-world evidence was ignored in America, and instead we were told theoretically that the kids shouldn't go back to school. There was no evidence of the kids going back causing harm. And indeed, so what I talk about with an abundance of caution is this peanut example with schools, and there's all sorts of other examples that caution can run in two different directions, and we should always be very wary and concerned when we're told that something is being done out of an abundance of caution.
So super quick, if your child's already got a peanut allergy, is there anything you can do, or are you cooked? And when it comes to that, like you can't retroactively expose them to peanuts because they're already having, severe anaphylactic shock.
Well, I wouldn't make any medical recommendations on your program, but my understanding is for children and adults as well who have allergies, whether to peanuts or other substances, you can do immunotherapy, which is usually through injections, a small amount over a long period of time, and that can help to some degree dial down that allergic response in the body, even if it doesn't eliminate it entirely.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.